Hey everybody, welcome to another Mancoll Minute, COVID style. I'm going to take my mask off here. We have plenty of distance between Marion and myself, just so you can hear me talk. I hope you've been getting through this pandemic like all of us. It's been quite an adjustment, and we're all trying to figure out the new normal, I suppose. But we are back operating, seeing patients, social distancing, have lots of things set in place. So please don't worry about coming in. We're doing a lot of telehealth still, a lot of the follow-ups that way, but we're always available for you. But I didn't want to have the Mancoll Minutes kind of go to the wayside as we wait for the rest of the world to kind of open up fully. So we want to kind of get back on track with some things we were talking about before, and that's answering some questions from my patients. And a question that's come up a couple of times now is, what is the highest BMI that one can have lipo360 or tummy tuck or even just cosmetic surgery in general? For those that don't know, a BMI is a formula of your height and your weight, and typically you want to be in that sweet range between 18 and 25, 26. Then anything over that we call obese. In my own center, we have safety criteria set up. I'm Quad A certified. I use board certified anesthesiologist, but we have set a threshold and said if you are a BMI of 40 or below and otherwise in good health with not uncontrolled diabetes or hypertension or things of that nature, that we are safely operating on folks there. If you're above 40, then we really need to work on weight loss ahead of time, just from the safety. Or maybe this is an operation we do at the main hospital, depending on what it is our goals are. The other thing going along with that, because the question was the highest BMI for lipo360, and I did a patient yesterday whose BMI was 39.5. I have a max on how much fat I will take off. My society recommends about 5 liters. Think of a 2-liter Coke bottle, soda bottle, water bottle. Think about 2.5 of those that are removed. That's a significant amount of fat taken off. It is not a weight loss operation, it's for contouring. And for some people, that's a tremendous difference. And for people who need more than that, we break that up into other surgeries, or we stage it. For example, I'll do a lot of lipo in someone's abdomen and then come back and do a tummy tuck. Because if you have a thick subcutaneous layer in the front and you do a tummy tuck, you're still going to feel very rounded, and those folks aren't as happy as they can be. But what I found, and I've got plenty of before and afters to show folks if you come in, is if I kind of debulk it first and then come back and do a tummy tuck, you get much flatter and much nicer outcome, and you can really shape the waist and the hips and everything else. So, long answer for the question, and to summarize it, is 40 is kind of the cutoff. 5 liters is about the most fat we can safely remove and send folks home. And then beyond that, I think folks need to obviously work on weight loss, exercise, and kind of preparation. And then I recognize how hard it can be for some folks to lose the weight, particularly if they're a little heavier and their joints are hurt or things of that nature. So that's all part of the conversation we need to have to kind of figure out what's the best, safest operation for you and timing of that operation. So till the next time, have a great Memorial Day weekend. Call if you have any questions, keep your social distancing, and keep your mask on.